Good afternoon. I'm Dr. Rachita Esther. In this session, I'm going to discuss about the basic details of local anesthetics. Under it, I'll also cover uh, how to write basically to answer the question. First of all, let's come to the question, what do you mean by local anesthesia? What is local anesthesia? Local anesthetics are reversibly block the impulse conduction and produce a transient loss of sensation in a restricted region of the body. That means its overall body is not anesthetized. Only some part of the body, there won't be any sensation. There won't be any impulse conduction that will be blocked by this anesthetics. These local anesthetics which are preferred for minor surgeries, they neither cause a loss of consciousness nor need a proper maintenance of vital functions during surgery. So, when we are giving the local anesthetics, there is no loss of consciousness. There is no loss of consciousness. Okay? But and also there is no need of proper maintenance. It's not a complete not needing of the any kind of so any vital functions maintenance. There is a need, but completely it's not avoided. But when compared to the general anesthetics, we are that much monitoring is not necessary. Okay, let's come to the what are the advantages of local anesthetics over the general anesthetics. What are the advantages? It is safer, and because there is wherever there is a need, we are using it is safer, produces good analgesia and muscle relaxation without loss of consciousness, and cardiac, pulmonary, renal diseases and diabetes pose to less problems. So these are there are another table which are showing about the what are the differences between the general anesthetics and the local anesthetics. When it comes to the local anesthetic site of action, peripheral nerves. When it comes to the general anesthetics, the site of action is at the brain. Central nervous system, there is a site of action of the general anesthetics. And the area of the body involved for the general anesthetics is whole body is involved. Whole body will have a loss of consciousness and the sensation. When it comes to the local anesthetics, that area will be restricted area. Wherever you wanted the loss of sensation, at that particular area there is restricted impulses. Consciousness, for general anesthesia, there is complete loss of the consciousness. But local anesthesia, there will be a consciousness. So, consciousness is unaltered. Care of vital function essential for the general anesthetics, because brain is already the central nervous system. So, all the central nervous system guided works, all the vital functions needs to be monitored and also be maintained when it comes to the local anesthesia, because we are peripherally causing the loss of sensation, that too at the site of action wherever we need the loss of sensation. So complete monitoring is not necessary. Physiological responses are very high when it comes to the general anesthesia, but here for the local anesthesia, low. Poor health patients, we cannot take any risk to give a general anesthesia. When the patient is in the poor health, and the vitals monitoring is very necessary for the general anesthesia. So poor patients, we will not take any risk to go for the general anesthesia. We will, because local anesthesia at the site, at that particular area wherever we wanted, so we are going with the local anesthesia if it is required. If can be done through the local anesthesia, we will go for the choice of the local anesthesia. But when it the need of the general anesthesia for those major surgery, like surgeries like major surgeries, there we will postpone the surgeries until the patient comes to the normal vital functions and the status. We will plan. Use in non-cooperative patient, general, in the general anesthesia it is possible, because the patient, when it comes to the general anesthesia, the person will be unconscious. So there is a no point of cooperation and cooperation, because he is unconscious. Automatically we can do many, you can do the surgeries. But when it comes to the local anesthesia, the patient will be in the conscious state, so there we cannot do things. The major surgeries, general anesthesia are preferred. When it comes to the local anesthesia, for the major surgeries, we cannot do. Major organ surgeries, we cannot do. When it comes to the minor surgeries, mainly we will prefer the local anesthesia. Okay, when it comes to the next slide, what local anesthetic used for spinal anesthesia? Mention the dose. Mainly, there are so many local anesthetics, but mainly we will use a lidocaine, bupivacaine, and the tetracaine we will use for the spinal anesthesia. The concentration of the lidocaine is the 1.5 to 5%. The volume will be 1 to 2 ml. Total dose will be given 25 to 100 milligrams per minute. Okay. When it comes to the duration of action is, for the lidocaine is 60 to 30 minutes. Bupivacaine is 0.5 to 0.75 concentration, percentage of concentration we are using. 2 to 3 ml we can use. Total dose up to 10 to 25. The duration of action is 9 to 150. Tetracaine is 0.25 to zero point 0.5. See, lidocaine, comparatively we are taking the higher concentration when it comes to the bupivacaine and tetracaine. When it comes to the comparative of bupivacaine and tetracaine, we are taking the lesser dose of tetracaine. And the volume we are taking 1 to 3 ml. Total dose also gradually reducing from the lidocaine to tetracaine. When it comes to the duration of action, tetracaine is having the more duration of action when compared to bupivacaine, and the bupivacaine has the more duration of action when it comes to the lidocaine. Let's come to the commonly asking the short answer questions. Enumerate the complications of spinal anesthesia and how can you prevent and how you treat those particular conditions. So here we will mention about the what are the complications of the spinal anesthesia. In the next video I will also explain the what are the different, actually this is the trial video I wanted to try off. In the next videos I'll explain about the about clearly about the local anesthetic procedures. In it I'll explain about all the different kinds of the local anesthetic procedures. In that, I'll also explain about the spinal anesthesia and their uses, all those things. Here, mainly, I just wanted to cover about the question and answer spaces. What are the definitions of the local anesthetics? What are the drugs we are going to use? And what are the differences between the general anesthetics and the local anesthetics? And now, we are question and answer basis. How we are going to, what are the complications can get, and what are the preventive measures or the treatment we can take. This question and this answer also I will make it to be very fine so that in the further video, so that you can learn and write this question as it is as an answer in your examination, so that you can get a good marks in your theory examination. Well, let's come to the first um, complications by these particular spinal anesthesia. One is respiratory